Good afternoon and happy Lupus Awareness Month. I'm pleased to welcome you to today's webinar, Lupus and You, a 360 approach to care, presented in honor of Lupus Awareness Month. My name is Giselle Morales. I'm a licensed clinical social worker and the program coordinator for Charlotte's Lupus Chat at the Hospital for Special Surgery. Today, we are excited to bring you a dynamic panel of experts who will share their insights on lupus care from a holistic, team-based perspective. This 360 approach highlights the importance of addressing all aspects of living with lupus, from medical management to emotional well-being and beyond. At the Hospital for Special Surgery, the Department of Social Work program offers the largest number of lupus support and education programs in the country. All of our programs are free of charge and available in English, Spanish, and Chinese. To learn more, please click the link shared in the chat box below. Where you can actually continue to learn more about our programs here at HSS. And so before we begin, some housekeeping items. Participants will be muted throughout the presentation to minimize any background noise. However, I do highly encourage you to submit questions at any time using the chat icon. I will be addressing any questions, as many questions as possible during the Q&A portion of the program. Finally, we truly value your feedback. So at the end of today's session, please take a moment to complete our brief evaluation survey. Your input helps us improve future programs. The survey link will be posted in the chat box at the conclusion of the webinar and also sent via email as a follow-up. So just to give you some overview as to what the purpose, right? The purpose of this panel is to help explore how people care, how people with lupus beyond labs and medications focus on their emotional, cultural, nutritional, relational aspects that are often overlooked. So we aim to promote compassionate listening, empowering patients to speak up, and encourage collaboration across all care disciplines. So we'll talk about some patient stories, experiences shared that I've received from patients while doing my work at HSS, and also myself as a patient at different systems and different institutions, right? I definitely encourage the curiosity, compassionate listening, and just openness. So feel free to share some experiences in the chat box as well. Any questions, again, I really, really highly encourage, take notes if you want to share them at the end or towards the Q&A as well. So to begin, I will introduce the panelists we have here. Dr. Kevin Yip is a rheumatologist at Wyckoff Medical Center. He is the head of the rheumatology department and associate program director of the internal medicine residency program at Wyckoff Heights Medical Center. He is a double board certified physician in both internal medicine and rheumatology. He attended University College London Medical School, completing residency in London, followed by further training at NYU's internal medicine residency program. He then completed his fellowship, his rheumatology fellowship at the Hospital for Special Surgery and New York Presbyterian Cornell. Dr. Yip has published numerous papers, scientific abstracts, and book chapters on various rheumatologic and autoimmune conditions, along with his own research endeavors, particularly in genomic variations in African American lupus patients. He has been recognized and inducted by the Gold Humanism Honor Society for his compassionate care and has won awards and scholarships from the American College of Physicians and the American College of Rheumatology. Laura Gibofsky is a clinical nutritionist at HSS, a senior dietitian at the Hospital of Special Surgery, where she specializes in delivering nutrition care for rheumatic and orthopedic conditions. Laura received her undergraduate degree in dietetics from University of Wisconsin-Madison and a master's degree in public health nutrition with a concentration in maternal and childhood nutrition from Case Western Reserve University in Cleveland, Ohio. Laura has authored numerous nutrition-related articles and lectures on a variety of topics, including managing inflammatory conditions with diet, bone health, and weight management, and has been cited in a variety of print and digital sources. Her professional focus is helping patients achieve their goals by promoting healthy, nutritious, and balanced food choices in a realistic and achievable way. Enqing Li is a holistic health coach at Wellness Within Studio, has spent 7 years spent in the Navy as a command fitness leader, enabled him to help guide sailors to get healthier and stronger. After exiting the Navy, he decided to fully pursue a career in health and wellness. He completed his bachelor's in exercise science, became certified as both personal trainer through the American Council on Exercise and as a holistic lifestyle coach and integrative movement coach at the Sheck Institute. His dream is to help people to start living life with more energy and connection to their body and mind by finding the root cause of what is holding them back and addressing them holistically. Mary Rose Carey is a social work manager at the Hospital for Special Surgery. She joined HSS in May 2022, and she is the social work manager of the rheumatology division. She is responsible for the strategic direction, planning, and operational oversight of program initiatives related to advancing the highest level of service to this community. She manages all aspects of social work services, including patient care, program planning and evaluation, and the development of procedures and protocols to address critical patient needs. She is also responsible for the supervision of social work staff in adult rheumatology, the Voices 60 Plus program, and the pediatric ambulatory care clinics. She ensures that patients who are at high psychosocial risk are assessed and provided with appropriate resources and referrals, and advocates for patients' needs through collaboration with the entire healthcare team. Her professional interests include the development of emerging clinicians, psychosocial issues around chronic and life-limiting illness for patients and their families, and the improvement of healthcare access. So these are our panelists for this evening. And so I am, going to say something that, one of the things that is very important about this particular topic, this was brought on by, in collaboration also with the nursing department at the Hospital for Special Surgery, very specifically by Alana Little, one of our nurses here at HSS. So big kudos to her for helping me put on this panel and to bring these experts together with for us tonight. So I am going to turn it over to Dr. Kevin Yip, who will begin the presentation.
Thank you, Giselle. Remind me to cut my bio a little bit shorter next time. Thank you so much for having me for the second time at Charla. It was a pleasure meeting many of you in person last time. But today we're going to be talking about a very different area of rheumatology and lupus care. And it's one which I feel many people sidestep, ignore, and sometimes it's out of ignorance, sometimes it's out of preconceived conceptions. From a little bit about where we stand as rheumatologists, if you just go to the next slide. What is a rheumatologist, right? So I would imagine that most of you here with us today do have a primary rheumatologist that you see. So our background, we are trained in general internal medicine. So in another world, I could be a fully licensed primary care doctor or an acute medicine hospitalist. But we, after residency, then choose to spend further years of training to specialize in autoimmune diseases, specifically in rheumatology. So that's important for us because, as many of you know, your disease often doesn't just affect one thing, it can affect multiple parts of the body. So our basic internal medicine helps us understand where we may need other specialists involved, for example, a cardiologist or a nephrologist. If you could go to the next slide, please. So when do you see a rheumatologist? Well, often we are the last people that many patients get to because the referral process can be very long, can be very difficult to navigate because a lot of our diseases can feel very vague. When you go to your primary care doctor and you say, hey, I have some fatigue and I have a skin rash and I don't feel very well, it's very hard because many, many diseases can cause such symptoms. And they say, the average time of a lupus diagnosis is anywhere between 5 to 10 years. And often it's when other specialties do not know what a diagnosis that they will refer them to us. One of the most common things, though, is rheumatology is actually a very old word. And rheumatism comes from aches and pains around the body. So a lot of our diseases start with joint pains or joint swellings. Now, all of us, as we get older and age, we will get pains and aches all around. So how do we tell the difference? And often it falls to us as rheumatologists to understand when is it a sprain, when is it an injury, and when could it be something like an autoimmune disease. Next, please. All right. So some of the things that you've probably heard 1,000 times during your own medical careers at this point is trying to understand the character of the pain. Most of us rheumatologists do not have your disease. All we understand are your experiences and reading from textbooks and studies, getting a general gist. So it's important. And lots of our patients will try and keep diaries, try and keep track of what their symptoms are like. Is it worse in the morning? How does it affect by your medicines or the time of the day or your diet or your energy levels? All of these little things, triggers, exacerbations, and things that improve will help us kind of pinpoint the flavor of your symptom and helps us point towards kind of flavors of disease and even what kind of medicines we can use and approaches we can use to treat that. Next, please. Obviously, lupus is not the only disease we treat. Many associated diseases are things like rheumatoid arthritis or fibromyalgia. Now, unfortunately, a lot of these diseases, they don't read the textbooks, so they can coincide together. What's to say that you don't have 1, 2, 3, or 4 of these diseases that we list here today? But just to give you an idea of some of the other things that we do treat, it can be anything from joint pains to arthritis that we all get, to even osteoporosis like bone problems, to infections like Lyme disease, just to give you a little flavor. All right. Thank you, Giselle.
Hi, everyone. I'm Laura. Thank you so much for having me. So, I'm going to talk a little bit about nutrition and lupus. Obviously, this is a giant topic, but I just have a few minutes. So, just to give a little bit of overview and hopefully some pointers that everybody can take away from today. So, if we can go to the next slide. So I think this is really important. I always like to start out by saying this, that there are no foods that cause lupus and there are no foods that can cure it. And I also always say this on every presentation I'm on. I promise to get everybody's phone number, everybody's email address. If that ever comes out, it is not something that I want to keep secret, that we're all trying to keep from you. It is something I want to share with the world. But what I can tell you that following a well-balanced diet, which is going to include fruits and vegetables and whole grains, and then we're also going to talk about lean proteins and oily fish, your omega-3s, will help manage the disease as well as some of the symptoms that we may see from the disease, as well as some of the medications itself. Next slide. So again, following a well-balanced diet is going to help reduce inflammation and other symptoms, help not only combat some of the side effects of the disease itself that Dr. Yip just went through, but also some of the side effects that you may be experiencing from the medications as well. And then again, because having lupus may put you at risk for having other diseases, particularly cardiovascular disease, we also want to make sure that we're keeping a diet that's focusing on heart health. And so we want to make sure that we're reducing the risk of heart disease, maintaining a healthy weight, and also making sure we're keeping those bones and muscles strong. So again, it's a important part of the overall treatment plan. But again, that's why I'm so excited to be speaking on a panel with such wonderful people, because it's just one piece of the puzzle, but it's not the sole thing. But making sure that we're keeping good nutrition is going to help us feeling good every day. Next slide. So I just wanted to give a little pointer, so hopefully some takeaways. So again, my job is I live this, I breathe this. I believe that following good nutrition is going to make all of us feel great. Again, it doesn't mean that we're not going to need the help of the other providers on the team. But so something that I can tell, and this is something that we can all take away from today, including myself, I have to remind myself of this all the time, is that we can all be eating more fruits and vegetables. So again, eating more fruits and vegetables, we have antioxidants, we have fiber filled with all different nutrients. And so that's a way to make sure that we're keeping our body healthy and making sure that we're getting the nutrients that our body needs. Again, if we're focusing on lean proteins, leaner meats, taking the skin off of poultry, but predominantly focusing on our plant-based proteins, legumes, beans, nuts, and seeds, and soy will have positive benefits. I also want to make sure that we're focusing on omega-3, so those can be found in our fatty fish, salmon, halibut, trout, sardines, mackerel, and then again, of course, our plant sources, chia seeds, flax seeds, and walnuts. Remember, I'm kind of summarizing a whole thing of what I'd be doing into a short little piece, but I wanted to hopefully give everybody some takeaways of what they can do. And then something I always want to encourage people is the hidden nutrient of fiber. It's fabulous. And so making sure that we're choosing whole grains when possible. But again, the more fruits and vegetables that we're eating is another great way to get fiber into our diet. And that's been shown to help reduce inflammation and help with gut health as well. So if we go to our next slide, just to give you kind of a what my plate should look like, we always want to try to fill half of it with fruits and vegetables. And especially now going into the summer months, it's exciting because we have some of those other fruits coming out. But half of your plate should be vegetables. And again, this doesn't mean French fries. This doesn't mean broccoli that's fried in oil. We want either raw or it could be cooked, broiled, grilled. And then we also want a lean protein. So we talked about either fish, poultry, or also our plant sources, tofu, or a different kind of substitute. And then again, we want a small bit of whole grains, brown rice, barley, bulgur. So the more color we think about, the more textures, the more exciting, but we want to make sure that we're including a wide variety of nutrients to make sure that we're fueling our body to feel its best.
Hello, everybody. My name's Enqing. Aloha. I'm actually traveling right now, I'm in Hawaii. So okay. So let's see. I'd like to really take just maybe about 10, 15 seconds for everyone to kind of become aware of their breathing. And just in this moment, maybe a few breaths. So I'll go silent and just kind of tune inward and notice how you're breathing in this moment. Because as we present. There's a lot of information going around, and when we're able to kind of, come into our body, we can really fully absorb it more and maybe use it in the future to navigate with our choices. And just notice the depth of your breathing. Notice if it feels restricted, or does it feel expansive? Does it feel easy, or does it feel maybe a little difficult? Nothing to judge, simply to notice. Currently, for myself, I feel a little nervous as I am speaking, but I am also very excited to share with you all how I approach lupus. So personally, I focus on my practice has been focusing on understanding how the body naturally heals, not only from lupus, but from all sorts of symptoms. And one of the principles I share with my clients is that the body will naturally heal when it is being attended to in the right environment with the surplus of energy. And I will go into what that means, it represents in the coming slides. Next, please. So for me, when I connect with my clients and really get to understand them, what I found is you know for myself, what I found really helpful is I'll start with the breathing actually. So I teach a lot of my clients to breathe because what I found with lupus or any autoimmune disease is that when the body is in a calm state and less stress state, the body will have a much better capacity to heal. So as you tune into your breath earlier, that's a moment that you gave attention to your body. And emotionally, when we give attention to our body feels nourishment from that. And there's an experiment I like to do quite quickly. If you all could take a moment and just close your eyes. As Dr. Yip mentioned earlier, there's so many different aspects that influence the symptoms of lupus. And now as you close your eyes, I like you just think of a moment in the past that you felt, the symptoms not as much. Maybe you feel a little better. And see if you can bring that memory up and then notice how your body feels with the memory. Maybe you were traveling, maybe you were with friends that you feel you trust, maybe you were in nature or maybe somewhere else. And then now I want you to switch the memory into a time where you feel extreme symptoms of lupus, something that whether it's your skin, foggy head, aches and pain, and notice what your body feels as you brought those memory up at times where you feel extreme symptoms of lupus. And now I'd like you to kind of come back into your body, clear those memories, and notice that just by bringing your memory up, your body will react differently to each of the memories, right? So the reason I'm doing this, and if you felt that difference, please put it into the chat so I kind of get some sense of whether this is working or not. All right, if you felt something different, you can just say you can say yes or you can say maybe or no. All that's valid. Just so I can kind of get a sense where you're at. And so to continue. Uh, so the next part, so the reason I used, oh, sweet, thank you, everybody. Um, so the reason why, so there's a book called The Body Keeps the Score. It's quite popular. Essentially, the base of it is that the body never lies. It's always storing, whether it's our emotions or thoughts, it's actually always storing our body. So I work with the body a lot. And yeah, thank you. So Jennifer says body felt tense when recalling lupus flare, right? So if our memories can contribute to our body's reaction to the negative, that means we can do that for the positive as well. So so that's where breathing comes in for me. Is that what I found? Every clients I've seen with chronic pain, aches, and chronic, digestive, sleep, foggy head, is that the body stopped breathing well. And if you ever seen a baby or if you had a baby, like if you look at babies, they naturally breathe through the belly. And that's what we're meant to breathe, how we're meant to breathe throughout the day, unless we're getting chased by a tiger. And that's so whenever our breathing changes, it's because we're adapting to stress. So there's no, wrong way to breathe. It's just that there's ways that our body adapts to stress, and there's ways our body that actually relaxes and feel calm and safe in our body. And that sense of safety is, to me, is the first step to the signal to help the body naturally heal. And that's where breathing comes in. I also just to the other two here, it says heart compass and nature. So heart compass is very similar to the body sensation. It's just simply centering into our heart, because when we feel joy, peace, and happiness, typically we feel it in our heart. So we can kind of use our heart to kind of essentially filter out through like of what of the choices we're going to make. I can go into that later if anyone has a question. And nature, what I found, and that's why I'm in, a part of me what is why I'm in Hawaii, is that as I found when I so I have my wellness center in New York City for 4.5 years, and what I found over and over again is that people in New York City versus the other part of the world, people in New York City tend to be much more stressed because of all the different, there's light, there's a lot of people, it's a lot of going, doing energy. And that tends to be in Chinese medicine where it's overly yang, meaning doing too much. So when we're able to come into nature, having the space to just breathe. So me and my partner went to Colorado in April, and this is the first time, and she felt like she could think better, more space to think and more space to breathe, simply to be in a better, bigger space. So that's and nature also fosters connection. And in Japan, they also offer something called nature therapy, where doctors prescribe you to go into nature if you have certain ailments. Next, please. All right. So a quick way to kind of see how you're breathing is that I like you all to invite, whether you're sitting or laying down, put one hand on your chest and one hand on your belly, and just take a breath in and just notice what expands first, whether it's your chest or your belly. Yeah. And now the proper way, so the baby breathe is through the belly. So and see if you can just invite your breath into your belly if you feel more chest. Just a little bit. And in the beginning, that may feel difficult. The easiest way is to lay down. And I typically recommend my client, about 30 minutes a day. to kind of check in with the body. So the breathing is really an opportunity to check in with the body. It's almost like seeing your body as a child that needs that a child that's in pain or of some sort, and it needs your attention. So so each day you show up for your body 30 minutes a day to give yourself that time and that space to listen to your body, to allow your body to heal. And so yeah, so as long as the belly expands first, that's the first step to practicing breathing. And breathing also brings in energy, and that surplus energy. So when your body has surplus energy, it will use that energy to naturally heal. Next, please. And just a recap on, yes, there's another areas that I go into is that for me, I always ask the question of not what, like what symptoms you have, but of what creates health. And what I found and what I've learned is that there's six main principles here. There's breathing, nutrition, which is what Laura spoke of, sleep, movement, thinking, and hydration. So these six principles are what creates global healing for the body. And if you ever think of someone that breathes well, eats well, sleeps well, moves well, thinks well, and hydrate well, they're not really going to have that much symptoms. So just kind of shifting the perspective from changing the way we ask questions and look at, instead of asking what, helps lupus, maybe ask like, what helps me feel better in general, right? Does drinking more water helps you? Does having a good night's sleep help you? Right. So just expanding, so I call this like the global healing aspect, like expanding the view to look at all what the body needs, and then once that's established, and then go deeper and more specific into your lupus conditions, and then that's where specialists can really support you when you have the general foundations grounded in your body. And I think that's it for me. Thank you, everybody.
Wow, I think I really benefit from following that. I feel very relaxed starting. So thank you so much, all of you, and great to join this wonderful interdisciplinary team on this discussion tonight. So I'm going to speak a little bit about the social work role in interdisciplinary care, which I thought was pretty relevant to since we're all here, and as well as supporting you all through your various treatment planning. So next slide, please. So I think one of the, me too, Laura, one of the biggest ways in which social work supports your relationship is in patient-provider communication. And some of these statistics may be familiar to you all, but the average medical visit is only 18 minutes. That's actually a couple years old, so it could be even less now. 80% of diagnoses are based on patients' self-reported medical history. So what you feel comfortable disclosing to your doctor really contributes to that diagnosis. So it means that what you're saying really, really matters. And conversely, 58% of what the doctor shares with you is forgotten. I think we've all had that experience. We're really overwhelmed in an exam room. We've been there for 3 hours. We're late for something else. Maybe you're even taking notes, but things go out the window, and it's really common. So what does this mean, and why does it matter? Solid communication is the basis for everything. It's a huge part of understanding your condition, the basics, as well as the risks and benefits associated with its treatment. And communication really plays a key role in maintaining that relationship, developing the relationship, um, especially one that involves support, empathy, understanding, and that good collaboration we're all looking for. If you don't have good communication, none of the rest of that can follow. And this matters because good communication, understanding, collaboration actually leads to more desirable health outcomes. Things turn out better when you feel more connected to your provider. Patients are more likely to feel heard, more likely to be in agreement with a treatment plan, and disease management actually is more effective. And of course, the outcomes and higher satisfaction are found. Next slide, please. So the way we try to work on this, this is not all inclusive, but these are a few key points. So advocacy, and that might mean working and speaking on behalf of you, which of course is important, but I think really support and helping you speak for yourself. Getting your own thoughts and ideas out there, feeling brave, is a really key way that we can support. As well as accessing outside resources. You come to a specific provider for a specific reason, but your care doesn't end there. And we try to make sure you're connected to resources in the community that can enhance the care that you're getting in any given situation. Mediation and translation, and I don't necessarily mean this linguistically, although of course we can facilitate translation, but really checking in and making sure everyone in the interaction is on the same page. And what are you really hearing the provider say? Is it what the provider's saying? And vice versa. Can the provider understand where you're coming from? Education, and this is also a two-way street. Helping patients understand information that's given by the provider and really helping the physician understand the patient's lived experience. That's a big educational component. We want to make sure the doctor understands who you are because that informs your treatment. Whether it's giving context to your medical history or your psychosocial history, any traumatic medical experiences in the past that may be coming into the current situation, existing systemic biases, power imbalances. Being aware of these can really help both parties come to the same page, and that's really key. Next slide, please. So I've said two-way street twice. I'm going to say it one more time, maybe two, we'll see. But medical care really is a two-way street. It's our responsibility, the healthcare team's responsibility, to clearly share the risk and benefit of treatment plans in a way that a patient can receive. And that might be different for all patients. Some patients have a super sophisticated understanding of medical jargon. Some patients do not. Some patients have had a diagnosis for many years and are familiar with things. Some patients are brand new to it. So we are really responsible for altering our approach to make sure you get the information you need. And what we ask for back is that you share what you need, your values, your preferences, your experiences, because that allows us to tailor treatment to a way that can really benefit you. I don't think I say it in a slide, so I'll say it now. If there is not buy-in and enthusiasm, collaboration from the patient side, treatment will work. It has to work for you. So shared decision making is exactly what it sounds like, coming to a decision based on both parties' understanding. So everyone needs to have all the cards laid on the table, know the best available evidence concerning the risk and benefits of each option, but decisions need to account for that guidance and the patient's values and preferences, not one or the other. It has to be that collaboration piece. And as I said before, that really leads to increased agreement, buy-in to treatment plan, better health outcomes, and that's what we all want. Next slide, please. So you've probably heard the concept of a safe space. Brave space is starting to pick up some steam ahead of that, and I wanted to touch on it a little bit because, we can't ensure that you feel totally safe. You may feel vulnerable. There may be feelings that you're lacking safety, that you're open to some sort of perceived or real threat. But what we can do is help create a brave space. And that really means that you feel supported to speak your truth, to speak your experience, and recognizing that it might be uncomfortable to do that, but you are being welcomed to do so, and that you are in a space where you can be heard. While acknowledging, again, that's tough. Differing opinions exist, one provider, and different opinions exist between providers, right? So saying, hey, we may not be coming to this with the same ideas, the same perspective, but we can communicate still, and we can come to, if not an agreement, a shared understanding, really validating those perspectives and making sure that all the information needed has been put out there. Next slide, please. So I know that this was shared in the chat, and I want to run over it again because these are such important, wonderful programs that we are so lucky to have here at HSS and throughout the community. So as it says, the HSS Department of Social Work Programs offers more lupus support and education than any hospital in the United States. These programs have been recreated and mirrored across the country and the world, as they should be. So we have Lantern, the Lupus Asian Network, a free national support and education program for Asian Americans with lupus and their families. the SLE workshop, a monthly education and support group, Lupus Line, again, free national telephone peer counseling service, which provides one-on-one support to patients with lupus and their families. Charla de Lupus, which Giselle spearheads so wonderfully, another national free peer health education group for Spanish-speaking communities. And teen and parent lupus chat groups, which are in-person chat groups for teens with lupus and their parents, a particularly vulnerable group in that sticky phase where you already feel like you don't belong. This offers a really nice opportunity for people to connect around their diagnosis and just around life. So we encourage you to check those out if you haven't already. Thank you.
Thank you very much, everyone. I think that was really, really great to be able to share a little bit, a little pieces of everything that everyone is working on and does, and really kind of allow for a lot more time for us to have that conversation, the panel discussion, present some of the questions that were asked during registration, but also some of the questions that are being asked currently throughout the chat. And thank you again. Thank you so much. This was really great. And again, I feel like each person kind of gave you a little tip, a little taste of what it is. Because obviously we can present the entire hour, hour and a half on every single one of you. So thank you again. Perfect. So one of the very first, well, I'll go into the questions that are here, but also I want to also like kind of lay the groundwork. Again, please, I encourage you to ask those raw questions as well, and just ask the questions that you might, have tried to ask your providers or try to explore online or have found online and want to kind of confirm or verify or kind of get some guidance or some direction on what that might look like or what we should, is this even something that you should even explore, right? Again, we are not necessarily giving you specific medical advice. We will also encourage you to really talk to providers, talk to your providers, talk to the people that are in your circles and in your healthcare networks as well. And also come to HSS if you haven't already. So one of the very first questions I am seeing here in the chat is, well, whether it's related, it's like, how do you treat or help brain fog and lupus? So I feel like a few people might be able to answer that a little. Dr. Yip, I'd start with you, if you'd like to go ahead and start.
Oh, so that's actually a really hard question. Because what causes that brain fog, right? Is it the 101 medications we're giving you? Is it the stress, anxiety, and depression? Is it the disease itself? Is it the fact that you can't do the things that you wanted to do before, like go outside and do the activities? From a conventional medicine standpoint, this is an area that we have been notoriously bad at. We have tried many different medications, for example, the ones we use for ADHD, and some of them have found some benefit, but even then, the evidence has been very, very weak. But it's multifactorial. If you are in chronic pain, of course, it's going to be very difficult to concentrate and get some sleep. If you can't get any sleep, how can you focus and concentrate in your day-to-day life? So part of it is identifying at least the more clear-cut triggers. But even then, we are notoriously not very good at this, and it's an area that we continue to struggle with, and it's continuously getting researched on. I know that it's not a very satisfactory answer, and it's not one I like to give either, but we are working on it. But sad to say, that's all we have.
I don't know if anyone else wants to add to that, but I think I will touch upon like when you said, where is it coming from? And it brought me back to like thinking and like listening to your body, kind of really kind of introspectively, like trying to figure out where is this coming from? Because there's so many different factors that might contribute. And kind of trying to like assess or figure those things out and kind of like navigate that, right? And then the different kind of research. And that's one of the things that I always encourage people to talk to the providers about and not dismiss it. Yes, hand up. please.
Hello, everybody. Enqing here again. Yeah, I'd like to add a couple pieces. What I found very helpful in just any sort of head symptom, headaches, fogginess, from a strictly physical perspective. And from the physical perspective, is that whenever we are stressed, the muscle in around the neck and the shoulder tenses up due to we using the neck and the shoulder muscles more to breathe. And we breathe up to 25,000 times a day. So imagine you're going to the gym and you're doing something for 25,000 times a day, right? So then your body has to ask so that your body has two choices: is either to breathe or to be in pain. Which one do you think your body will choose every single time? It will choose to breathe every single time, because when we don't breathe, we die, right? So then my intention has always to kind of my goal of this, there's so many areas I can talk about, but I like to give something that's practical that everyone here can try out today, even right now, and that is back to breathing. Is that so one of so talking about the neck tensing up. So when the neck tenses up, it actually constricts the blood flow in your neck. And so then there's lack of blood flow and lymphatic flow to your brain, and lack of lymphatic drainage from your brain into your collar here. That's where the lymphatic, in that flow, you can experiment with this. Anytime you feel brain fog or headache, is to just lay down. Just by laying down, there's less gravity on your neck, less constricting on your on your neck. So then there will be a bit better flow. I've experienced this myself personally, because I've had brain fog. I think 10 years ago, like, even nowadays, if I get stressed, I will still have brain fog. And I try a lot of different things. And one of the best things that helped is to lay down and just breathe with my belly. So then the neck doesn't have to work as hard to tense up. And typically within about 10-15 minutes, it feels a lot better. It's not, so it's like a different option than napping, just laying down. If it's laying down is hard, laying on your side in the fetal position, that's easier because that's a safer position. So that's one of what I want to throw out from the physical perspective.
Thank you so much. I appreciate that. I appreciate your tips and tricks that we can probably incorporate into our daily lives to be able to better support and manage some of these symptoms when they come up. And I'm curious to see, like, if people try it out, like, how does it feel? How does it work? And then that's part of, like, something that you can put in your toolbox moving forward, right? And honestly, one of the things that I ask and I will put out there is, like, what do you think a 360, and this is open to the entire panel, like, what do you think a 360 approach looks like in a practice, right? Like, what does that look like? What does that sound like? And is it something that is welcomed from your perspective, from where your area of expertise is? And how do you welcome it if the person doesn't bring it up? Like, how do you open up those conversations? Not sure I can start.
That's a good question. I think, I'd love to hear from everyone about this because I think everyone will have a slightly different answer. But I think just making sure that people feel like they can be heard. You can speak here. I'm not here. I mean, I specifically am not here to tell you what to do medically. But in general, healthcare, we are not here to just prescribe, to just tell you. It is not, I talk at you, you leave and do what I said. Um, although that can be comforting in a certain way, just making it clear, not only are you welcome to share that information, but we need that information. We need to know what you're doing outside of this office. We need to know what's helped you in the past, what hasn't helped you in the past, because how do you move forward without having a full understanding of who someone is and what their experience with whatever the diagnosis has been.
Mm-hmm.
So, the World Health Organization's definition of health is not just the absence of disease, but actually a state of complete physical, mental, and social well-being. But from a conventional medicine standpoint, the thing that we understand the most is the disease. And a lot of us in the medical world would argue, well, that's obviously the most important thing. You're not going to care about whatever other symptom if your organs are going to be damaged. And to some degree, that's true. But what it what we're not so good at is understanding that whole breadth between it. How can we actually make your life feel better day to day? I remember when I started my career and I was trying to tell a patient of mine, but what about your kidneys? You have to take this medication. And I wasn't listening to the fact that actually she was more concerned by how many medications she was taking, because it stressed her out and it gave her anxiety, you know? So I think, starting with your medical doctor is always the best or a good first call because you don't want to try and mask something when it could be the early signs of something more serious underneath. But I do think that a lot of conventional medical doctors do need to be more open-minded about some of the other therapies that do make someone feel better. Maybe it doesn't cure a lupus, maybe it doesn't slow down your kidney damage, but if they, whatever it is, Tai Chi, cupping, acupuncture, if that makes your patient feel better, is that not a form of medicine? Is that not more effective than some of the stuff that you've been taking for years and years?
Yeah.
One of
So,
the things that I always talk to my patients about is if they bring something up, kind of to what Dr. Yip was saying, is if I know something isn't harming a patient, I'm fully in support of it. Once I find out that maybe there's something that's interfering with their medicine or there's a different way about it in which I can talk to them. But if there is something, so for example, a very common thing I might hear is someone is avoiding nightshades or someone is avoiding dairy or someone is avoiding gluten. If they want to do that and they feel better, by all means, I am there to guide that journey and give them my expertise to make sure they're also not compromising their nutritional status. So, for example, if you take out dairy, you may not, and you may be on steroids. Your risk for bone fractures is much higher. So I need to make sure that there's adequate calcium and vitamin D in your diet from other sources. So if you want to do something, it's our job to help make sure. But like Dr. Yip said, we want to make sure that you're doing things safely. But if something is working and it's not harming you or interfering or causing more harm, we all need to be more open-minded to that. And that's why we're here as the experts, because we want to help guide that journey, not interfere with it.
um, I'm gonna throw a curveball out. Hopefully that's okay. And the curveball is I believe that the experts on lupus is every person that are actually experiencing lupus. And I really want to emphasize on the importance that in my perspective, when my client comes to me with a challenge, because us human beings are extremely unique and individual, and your experience in your body is the most powerful experience, and we cannot live your experience. We can only hear from your description, right? There's a place and time for all the expert on this panel. That's why we're here and gathered. But I do my way of looking at 360 approach is really giving the power. Some, if most of the power back to the clients that experience lupus symptoms or any other symptoms, because to me, like like it's hard to describe because it's just so different. But so for example, with so what Dr. Yip says is that if you've done something and you feel like it helped, you know, like that's to me is your body telling you that it enjoys it and it helps it feel better in a certain shape and form. And these are extremely important moments to kind of bring up to for yourself to reflect upon and to your doctor that or any person that you're going to for support. And so some personal comment, journaling, right, helps. Different supplement helps, right? So, and in my experience, that any at a certain global level, any activity that requires us to show up for ourselves in any shape or form and attend to our body in any shape or form, whether it's going for a walk, whether it's doing Tai Chi, whether it's doing breathing, whether it's going for yoga, whether it's connecting with your friends or family, anything that allows us, at least in my perspective, to show up for ourselves and like showing, like every morning you're taking a certain green juice, right? That's you intending to take care of your body. And I wonder, there's always been a question, what's healing your body more? Is it the intent of you showing up and taking the green juice helping you more, or is it the green juice that's helping you more? And it actually doesn't matter. Because, well, at a certain level it does not, but then it can get very specific because there's like for what Laura says, like some nutrition isn't what the body needs, and we may not, that might not be our field or expertise. But what I found is that each of us, when we eat food, we will always feel how the food affect us. And the question is, have you ever felt bloated, lethargic, gassy after you eat a food? And these, so another, I like to, it's to take notes, like especially when it comes, like you just simply, and because once you take notes and see how your body responds, and you give to your healthcare provider, they're going to have so much more information on what may work better for you. So, so for me, it's really empowerment. Know that you are much more powerful than you think. And then that your experience, I invite each and every one of you to sit down and write down like every single thing that you've tried, and whether like in the last 10, 20 years or more, like what's helped you feel more centered, what and what's creating more stress, whether it is in your mind, right? Another, connection to fogginess is too much thinking. We're all in a world of very much thinking. We grew up, learning in a school where we sit and memorize things and learn how, what to think, not how to think. So, and then when we think too much, our brain fire these neurons, and it really engages our brain too much, and then that can create tension all around the skull. So that's another, direction to look at. So my 360 is really to understand like the power of each of your experience, that no experience is wasted. So yeah, that's my perspective. Thank you for listening.
Well, thank you so much for sharing. I think this is great. And kind of gives people a little more information. And I'm sure people loved hearing that the person living with lupus is the best expert at knowing what lupus is and how it feels and everything else. And also because one of the biggest things with lupus is each person's journey, experience, symptoms, everything is their own. And no two patients are identical. What one person might benefit from or find helpful or find that is working for them might not for the next person. The next person might not find that. And so it's really it's not a one prescription, here you go and you're off. It's really listening, taking that into account, taking all of what the person is experiencing and sharing. And so you need a provider and you need people in your corner that are going to be able to do that for you. So it's extremely important. So a question that I'm going to ask directly to Dr. Yip is, um, many patients say they feel reduced to lab results. How do you balance the science of treatment with the art of listening?
That is a really hard question, actually. Uh, so, uh, Unfortunately, rheumatology is not as exact a science as we would like to believe. And sometimes these antibodies can actually mean nothing at all. But just like Enqing said, actually, it's how your body expresses. It's what we call a phenotype. So 1 in 4 people will be positive for an ANA antibody. And you just need to look around the room to sort of say, well, of course, 1 in 4 people doesn't have lupus, right? So that's to say that you are more than just your lab results. And unfortunately, too many doctors are focused on your results rather than actually your state of being. Having said that, those antibodies do give us a little signal. They may not give us a signal right now, but they may give us a signal in 5 or 10 years' time. So none of this is an exact science, but it helps us stratify risk. So sometimes, unfortunately, that's a fixation. And unfortunately, we forget the patient and the person in front of us.
Thank you so much. And that in itself is extremely true. Right? We can all we've heard this, we see this. And it's also how many times, and I go with patients, I'm in the exam room. I've been in the exam room with Dr. Yip, where a patient is asking questions or has all these feelings and saying like, I feel like absolute crap. However, lab results all look great. And it's like, or vice versa, you feel horrible, but the labs are showing something completely different. And it's like reconciling that and feeling like well, so what is going on, and like that unknown, and then just kind of any direction and guidance, and that's why it's like really helpful. And I keep seeing and people highlighting journaling, keeping track, making notes. I say this all the time to folks. I know myself. I say write things down, use the my chart, the portal, to communicate also with providers, but also take notes, because I know that when you get into the exam room, or you get into the studio, or you go into that session that you're going to meet with someone, sometimes we all feel like fantastic. We feel great. All of these other things don't come up. We don't think of it. We think we will. However, it doesn't come up. So how to continue to have that kind of conversation, and share and paint that picture that will lead to other kind of outcomes, and also more collaboration and maybe more results, with providers. Absolutely. And there's many, many questions coming through. Definitely questions in regards to some of the breath work. And are there any kind of resources that you can share, that you'd like to share, that people can use and utilize, for that breath work, Enqing?
Absolutely. Thank you for the question. Yeah, so I'll put in the check, but what you want to look for is what's called diaphragmatic breathing. And the basic description of that is the easiest position to practice is laying down, laying on your side, on your back, and then progress into sitting, and then walking. And yeah, so I'll put in the chat later. So it's diaphragmatic breathing. And because that's actually the primary muscle that's involved in breathing. And what's interesting is looking back, I invite every one of you, to look back on your experience of when your symptoms flared. And when that moment happened, I wonder, what was your energy level? What was your stress level? How was your sleep? How was your nutrition, right? Typically, when we don't sleep well, when we don't, well, more overall, the global aspect is that when we have low energy, everything else kind of falls apart. That, so we can just summarize that for this to make a point. So that means that anything that you do that gives you energy, going outside, getting some sunshine, hug a tree. I like hugging trees. I know, practicing some breathing, seeing a friend, eating a good meal, prepping for sleep, anything. It could be anything. That's the options endless. But whatever that gives you energy, if you make a list of that, and then intend to do most of it or some of it every single day. I always recommend my clients to have a ritual. A ritual is or routine, we call it, is where we intend at this moment of the day that we show up for ourselves. And because many of us, especially women, what I've seen in my clients is that they give too much, way too much, and they do not receive it. So imagine you're a battery and you just keep giving and giving. What happened to a battery that kept giving? It burns out. It doesn't work. It stopped working. So that's kind of what happens to our body, is that when we give too much, the body has to shut down. So whether, it's a forced shutdown, that you're forced to stop doing things for others and invite you to back to your body, or you can choose to typically morning time is good, or evening time before bed is our two times that's good to add in that 10-15 minutes of or 20-30 minutes of self time to put yourself first, so your cup can be full, so you can give and help others more. So I'll put that in the diaphragmatic. So just kind of inviting you, to see it from an energy perspective. Because what I found is that, my partner, right, when I trigger her, I will often ask her, "How's your energy? Like, how are you feeling? How was your sleep?" And so far, every single time is usually when her energy level is low, like poor sleep, poor food, lack of hydration. That's when I trigger her way more. Like like hand on hand. And when she had a good sleep, like it's a simple example is when I hold her hand, I can, because of what I do, I tell her that your shoulders tense. And this happened like 3 days ago. And she got all like I'm judging her, like she's doing something wrong. And then the next day we had great sleep because we were outside all day, because we just came to Hawaii. There was jet lag. And I told you, oh wow, we knew that our sleep was good. And we were walking, I was holding her hand. I was like, what if I told you your shoulder was tense now? She was like, I'll be fine. Yeah, like completely different reaction. Yet the facts never changed. Her shoulder was low tense, but she absorbed it differently because her energy was so much better. So just a little, segue, to reflect on what is your energy. There's so many ways. There's a book I will write in that I highly recommend to all my clients to just read. It's how to eat, move, and be healthy. That has helped me and my clients a lot.
Thank you so much for sharing that. That was really insightful and helpful. I'm curious, like I do wear my Samsung watch to sleep, so I do keep track of my score to see how that kind of like reflects in my day-to-day interactions as well. And we can all, I feel like at any given time, make better choices with some of the things we do. So that's really helpful, and just to be mindful of that as well. I did see a question come in. Can social workers help support patients that are seen in the HSS clinic?
This one is so easy. Yes, absolutely. We are available to our clinic patients for all sorts of needs. We help navigate the healthcare system. We help navigate community resources. I always tell the providers this, if anything, just ask. Hopefully I can help. If I can't, I'll find out who can. So
And I'm
please
going to
make
plug
use of
myself
us.
in there. I'm going to plug myself in there
As can Giselle.
as a social worker at the Hospital for Special Surgery that specifically only sees patients that have lupus in both pediatric and on the adult side. I am an available resource. Another thing about a lot of the programs, which we highlighted earlier on, is you don't have to even be a patient at HSS to receive support or attend any of those support programs. They're available national. I did see Charla was life-saving, and I'm really happy to see that in the chat. That's amazing. That's great. And I know something that continuously comes up, I'm gonna say, and this is a hold on, random segue, is about garlic. So Laura, everyone talks about garlic. What? Avoid garlic, no garlic, lots of garlic. My mom has told me put garlic under your tongue if you're feeling ill, and that's like something that works for me. What do you encourage there?
Yeah, so Dr. Yip can correct me if I'm wrong here. So cooked garlic in small amounts, which is typically how most people are having it, is typically something that's generally recommended. It's not something that we tell patients that they need to avoid. The only time that we would tell patients to avoid it is if they're consuming large amounts of raw garlic, and I mean vampire style amounts, or in a garlic supplement, because there have been studies that have been shown that it over stimulates the immune system. And so patients with lupus already have that. So we don't want to do that. The other thing I tell people is, again, remember these studies with food is also particularly challenging because nobody is going to sign up to live in a bubble. And there are so many other factors, and we've talked about a lot of them, and each person is so unique. So it's very difficult to pinpoint exactly when it comes to specific foods. So then we kind of do what we think is best and make these large general recommendations to make it safe for as many patients as possible. So again, right now what we're seeing, and again, this could change tomorrow, but in general, small amounts of cooked garlic in your diet or garlic powder that you would be using. And again, I think that most of us are using that. We're not going through an entire garlic powder is considered safe. It's when we are talking about large quantities of raw garlic and garlic supplements that we are typically telling our patients not to do.
Thank you. Dr. Yip, do you want to add anything to that?
My dad used to eat garlic extract pills because he thought it was good for his heart. So it's that kind of stuff, that level of garlic where you're having like concentrated amounts of God knows how many garlics in a pill. But if you're just going to season your food with it, that doesn't seem to be an issue. The other tricky thing, as Laura mentioned, is every person is different, and we don't have large scale studies of good evidence. So a lot of my patients ask me about things like turmeric, and I can say that for some of my patients it makes a difference, some of them it doesn't. So do feel like you play a little bit, but don't be too disheartened if one doesn't work for you or if something does. Explore it.
Mhm. Yeah. Yeah. I think that's part of the conversation. And Laura, you mentioned something earlier. It's like if some of the things are working for you, how just kind of like checking in with yourself and seeing, and like if there's no contraindications with medications and other things in your, your health kind of panel, like being able to talk about that. And it's like each person responds differently, right? And, there isn't one surefire way to do things. I know many times people talk about, the Mediterranean diet, and that's really, really something that is pushed and, you know, something that continues to be shared and like, or keto or all of these other diets that are out there or fads or fasting. So what do you encourage and how do you kind of help the patients that come to you that are seen by you kind of navigate and really check in with themselves to see how that kind of works for them? Hmm.
Yeah, that's a great question. There's a lot to cover there. So again, I always say there's nothing really sexy that I'm selling. I strongly believe in a well-balanced diet that includes all of our major food groups, fruits,
Hmm.
vegetables, whole grains. I sometimes sound very repetitive, but there's a reason why, like I'm not on TV doing all of this. I'm working at the top hospital and I'm proud to do it. And trust me, like I say, I will get everybody's name and numbers when that hot item, but the idea of, oh, we just need to eat kale or we just need to do this, I want everybody to realize that there are so many other things that are going on. I talk about nutrition as roots in the ground, and I strongly believe that. And so that tree is going to, that wind is coming. And especially when you have lupus, and as Dr. Yip mentioned, sometimes that comes with other diseases as well. That wind is blowing, and it's just a question of, are you going to fall over? And that good nutrition is going to make sure that your roots are so far in the ground. Sure, you're going to sway from side to side, but you are not going to fall over. And so that's what we want to make sure that we're doing when it comes to good nutrition. And what happens with fad diets or focusing on one thing, or when we hear that, nobody sticks to it. It is happens for 1 week off, 1 week on. And so I like to get rid of shame, get rid of all of these notions of what you should be doing, try to understand what people are doing, try to understand what they're thinking about doing. But the most importantly, I try to start with, and again, hopefully everybody can take this from it, add more vegetables to your diet. We can all increase that adding into our meals, adding into our snacks. So I always say pair something you want with something that your body needs. So we may choose chips, we may do that, but there is nothing in any of those foods that our bodies actually need. Fruits, vegetables, whole grains, those are things that our body needs to flourish. And so making sure that we're doing that. And then we can work on the other stuff as far as maybe cutting back on some things, but focusing on including more of the good stuff is always a good place to start. And so no labels, just eating right, clean, minimally processed, understanding the foods that we're putting into our body. And again, the more colors, textures, varieties, interests, the better. So hopefully that answered it.
Yeah, thank you. Yes, please unmute or
Oh,
fan.
oh, hello. Yeah,
Hello.
so I mentioned this earlier with garlic, but also food in general, is that there was a question on, how do you know like what food, right? So I like to really use my client as use their experience as the experiment, and what I usually invite them to do, and I give them a notebook to just really track all the starting tracking point is just write down what you eat, when you eat it, and then typically within 10 to 20, 30 minutes, your body will have a reaction to the food you eat,
Mhm.
right? And then over time, over the course of a week, 2 week, and 3 week, if you're not sure, is this, rice bothering me? You can keep trying it. So for me personally, I had foggy head. It was like 3 years in, and then I hired my coach, and then she said, there's my rice, and I'm Chinese. So I gave up rice for 3 years. So it's very challenging, but it, allowed me to sleep better, less foggy head, right? So personally, and it was from tracking, right? Without that information given her, she could have just gave me any advice of what is recommended for any person. But with tracking, which takes a little bit more work, but about 10 minutes a day, you're able to kind of correlate what you're eating and how you feel. And then you become empowered in knowing what your body needs. And and then you can share that with your medical provider and your anyone that's on guiding you and supporting you and healing on this journey.
I think
Thank
that is
you.
so, I'm sorry, Giselle. I think that's so important. And it brought something to mind while you were speaking, because tracking and thinking about these things, those are all part of knowing yourself, right? And I realized that that's really where we should have started, or where I should have started, at talking about supporting you and speaking, supporting you and sharing your story, but it's also about helping you learn your own story, right? Giving you that space to think about it, encouraging you to journal, meditate, all of those things. Um, because you can't share about yourself if you don't know yourself, right? So I think it's important to do that work. Set aside time to, if it's tracking your food, if it's thinking about what brings you joy, if it's doing breath work, stress relieving, really get to know yourself so that in turn you can share that self with everyone else and help support your care.
Yes, thank you so much. Yeah, there's just so much insight, and that's why I'm really happy it's being recorded. And I know if people have asked, we're recording this to be able to share so that you can continue to you can go back and listen to certain points and just kind of get more information on the links or the resources that were shared as well. But one of the questions that I see here is that some of us with lupus have been diagnosed with secondary conditions like fibromyalgia or Sjogren's. Since these secondary conditions can cause similar symptoms to lupus, it's hard at times to know which condition is causing the pain, discomfort, and toxic fatigue. So, who would like to start with that one?
So I guess I'll go.
Sure.
Unfortunately, a lot of people don't really explain some of these as well as they could. And we think of these diseases as you have A, B, C, you have lupus, you have, E, F, G, you have Sjogren's. But a lot of these conditions actually overlap with each other. And that's
Mm-hmm.
because your immune system actually affects many parts of your body, right? But your body doesn't read a textbook that says only ABC. Maybe your body says CDE. So I think of a lot of these diseases as brother sister um, families. And often a lot of patients with any autoimmune disease will have an element of Sjogren's syndrome. And I don't care what kind of disease. It could be lupus and Sjogren's. It could be rheumatoid and Sjogren's, right? Fibromyalgia is a little bit of a slightly different category. And the reason why is because it's almost your body's continued response to some kind of stressor. So Enqing can tell, you all about the chronic pain that he sees, right? But it doesn't really matter what the stimuli is. So analogy I tell my patients is if I whipped your back every day for 20 years, and then one day I put a feather on your back, what is your body going to feel? It's not going to feel like a normal feather because your body has been sensitized to that kind of pain. What if you got hit by a car and you have 20 different surgeries and 20 different screws all in you and you live in chronic pain every day? Your nervous system is used to that pain stimulus. So now any feather, any touch feels like pain. Now, if we expand that analogy, you have a lupus flare, and you probably had lupus for years and years and years before you were diagnosed. And all of that achy pain, the achy joints, sensitizes your body. So your nervous system now only feels pain, right? So a lot of different things outside of rheumatology can cause fibromyalgia. A lot of different things in rheumatology look very similar to each other. And that's why it's really important to get a good diagnosis firsthand, but also, like you said, to reevaluate, hey, actually, are these symptoms more this, or has it evolved to become more that? Because your brother
Mm-hmm.
over time can look like your cousin over time. It's difficult to discern whether it's A, B, C, or D. It truly is. Some of my patients can, some of my patients can't. And sometimes it has to be a bit of trial and error. So I ask my patients, please have some patience, some grace for your body. Unfortunately, these medicines that we use don't act overnight. And frustratingly, they can take weeks and weeks and weeks. So, actually, like we mentioned earlier, tracking your symptoms and getting something like a diary actually can do wonders because you're not going to notice the difference overnight.
No, yes, absolutely. There has to be an app for that too. There's so many different things out there that we can absolutely utilize to be able to keep track of that. And I know I'm just gonna it's not on the chat, and I know there's a lot coming in. but I wanted to talk about like the pain because you talked about and you touched upon pain and like managing pain, right? Some of the things that come up when I'm in appointments with patients is that how do you manage pain outside of just prescription medications and things that they don't want to take. So what are some of the recommended things holistically that we would want to also share with people and recommend and encourage um, for our patients, our lupus patients?
I think I'm going to defer to Enqing for this one, actually.
Oh, thank you, Dr. Yip. Yeah, what comes to mind? The first one, if you're able to do it, go outside and walk.
Hmm.
Walking is very powerful. It's very clearing for the body. It's very stimulating for your digestion. And so we're able to digest better, absorb better. Um, and then when you walk, I typically tell my clients like the first step of breathing is not to breathe correctly, right? So there's no correct way to breathe. It's just there's an effective way to breathe. And well, there's just how the body adapts to breathe. So the first step is to simply to notice your breathing as you walk, if possible, or just start with walking. Typically, the more energy we have, the more we can actually show up for ourselves. But when we have very, very low energy, then it's better to just lay down and do your belly breathing because your belly breathing is a movement of your diaphragm, which actually improves your digestion because the belly expands and comes back. That's your body actually digesting, pumping the lymphatic system, pumping the blood, moving your digestion. All of that is happening when you just breathe. Another thing is pain, right? So an easy way to look at pain from the physical nervous system perspective is that pain happens in the fight and flight state. And that's it. When we go into that rest and digest state, which when we slow down our breathing, it's actually what I found, it's impossible for the body to go into a fight and flight state when you lower your breathing to about 6 to 10 breaths per minute. The average breathing is about 16 breaths or more per minute. Yeah, so you can kind of tell, when we get scared, our breathing gets fast. So when you manually slow it down, laying down is the easiest. Then you're teaching your brain and your body that it's safe. It's safe to be in your body and it's safe to be here. And that shifts you into that. So it's not really an on and off switch for your nervous system. It's like a scale. Like as you take time to breathe, you'll start to transition from that fight and flight state into that rest and digest state. And in that rest and digest state is when the body heals more optimally. In the fight and flight state, it's like your brain is thinking and believing that there's a tiger that's going to eat you really soon. And it's as real as anything out there that's right. So by using your breathing as a tool to teach your body and your brain that you are safe, that there is no imaginary tiger, um, and to bring you into the moment. And then physically, it's giving you more energy, improving your digestion. If you do it before sleep, it'll increase. They've shown in research, like diaphragmatic breathing before bed increases your REM sleep and your deep sleep, right? Because so then you can actually have a better quality sleep, and then in sleep you don't have to do anything. Um, and there's another thing, if some of you to reflect back on if you ever wake up at night, in the future, see if you can notice your breathing rate. Just watch your breath. For me, about 6, 7 years ago, I learned how to breathe when I was 25. I'm 32 now. And once I learned it, I noticed how fast I was breathing just like when I woke up, it's really fast, and then I practice my breathing. And nowadays, when I wake up, some days it's still faster than the others, but typically it's slower and deeper because the body never lies. Once you start to listen, your body tells you everything. And this is going to be a little bit out there, but if some of you want to try, is that if you bring food, if you ever see babies or there's is that you can track your food and see how you feel. But there is a sense in each of our body is that I've done this test where people wear Apple Watches and they come in with neck pain, and I take off their Apple Watches, the neck pain goes away within about 5 minutes. It's kind of weird, right? But then if you go into the science, is that the Apple Watch produces the EMF, which is the electric magnetic frequency, and our nervous system use electricity to communicate. So it's distorting the communication. So if you have any electric devices on your wrist, uh, try it out. give yourself like don't believe anything I say. Experiment with it. Experiment with the breathing. Experiment with tracking your food. Experiment with taking, going into nature, taking off your Apple Watch. What I found was there's typically like a 10-15% strength difference when I test for grip strength when I take the Apple Watch off and versus on, right? And it also works same with food, but I'm not going to go too deep into it. But for now, it's easier to just track your food. But for some people that's sensitive, that's really sensitive, if you hold your food in front of your belly and breathe, if the food's good for you, you'll feel that breathing becomes easier. If the food's not good for you, it's going to be very restrictive. You try it out. Yeah, it's sometimes, but it takes some practice there. Just so uh, And I mean, there's one more on my mind. A very simple thing to do with breathing is to bring your leg up against the wall. So at night before you go to bed, if you don't have a wall, since you're in New York City, you may have a door. That's a joke, because because there's no wall space. Yeah, so you can so you bring your hip as close to the wall as possible. It's not about having your butt touching the wall. It's more about having your butt touching the ground. But bring the hips as close to the wall as possible and bring the legs up. And what that does is that it helps your body drains lymphatic because lymphatic is your body's detoxification system, right? So if your body doesn't get that detox, if you're in too much pain, you're not moving a lot, that moment of detoxification for your blood to drain, for your lymphatic to drain, that's going to make miracles. And when you breathe in that position, you want to imagine breathing into your low back. That's where your kidney is at. And your kidney, in Chinese medicine, the kidney is probably the most important organ because kidney governs fear, and the body stores a lot of fear in the kidney area. And this now going into the emotional perspective of pain is that when we, how why do we want to go? Is that so stress and fear is very much connected. When we experience fear, the body tightens up, and compression and inflammation is the root cause of pain. So then, whatever you do that helps you to breathe freer or feel more open and more expansive, it will help you reduce and manage the pain. So when you go up, legs up, and you breathe into your low back, because when we breathe, you want to imagine filling up a balloon with water. It kind of expand from the bottom and goes up to the top. And when you have that visual and you breathe that way, it really nourishes every organ in your body. And that opens the channel from the nervous system perspective. Pain usually comes from some form of compression, and that really opens up the spine in your low back, in your mid back, and in your neck. And you do that typically, anywhere from 10 to 20, 30 minutes because the gravity is not putting pressure. So leg up against the wall, breathing, and just uh, and what's funny, I've been trying recently is having a voice in my head is just and I ask myself, how am I feeling? Like just self-check-in. Like throughout the day, if you can invite yourself to check in with yourself, because sometimes, most people, are busy. So like, how am I feeling really? Like, because so I've been, maybe that helps too. Just to be honest and appreciate and honor your body's experience because pain is not something to get rid of. Pain is something to be listened to.
Mm-hmm. Yes. Yes, definitely. Our body does tell us and gives us some guidance and somewhat of a compass, right? So really kind of checking in with ourselves. And there was a lot of great tips there. And I think I do see the appreciation for the baby references as a lactation consultant I see in, in the chat. Definitely. So we have and cooperation like that, the EMFs in their environment. There's a lot of different things that are coming out and are being explored and a lot that people share. And at the end of the day, similar to all of the other things, is like what works for you and noticing those things. Like being self-aware is truly, truly important, I believe. So, I know as we're wrapping up, like this could have been a lot longer. I pushed for the hour and a half, I know, and I do want to be mindful of everyone's time as well. But one question that I want to just put out to everyone as far as our panelist goes is, what's one thing you have unlearned in your professional journey because of something a patient might have taught you? I know it can be hard and difficult, but what is something that you have learned through your patients, right? And I know it's hard to pick just the one, and I'm throwing this out on the fly, but I really want to, yeah.
So I've had a few patients throughout the years with incurable or end-stage diseases, and I often was at a loss of what to do. We had tried anything and everything. And despite that, I would see them every so often just to make sure new things had come up or things hadn't changed. And she once turned around to me and she said, actually, Dr. Yip, just being here, talking to you and being listened to really helps me feel better. And I kept that with me throughout all the years because
Hmm.
I realized that it didn't matter what medicine I threw at her, it wasn't going to make a difference. But actually, just having an open mind, an open heart, an open ear, and maybe a shoulder really helped her more than any medication I could. Um, so finding and leading on your support network, which can be very difficult and be filled with so many different conflicting feelings. But I would encourage you to reach out. You are not alone in this, and there are people with you.
Yeah.
Dr. Yip, you gave the beautiful social work answer. But that was great. And I think, I don't want to piggyback too much, but I think that that is so true and so important. We never want a patient to feel alone, or isolated. And that's a big part of why we're all here, right? And why we're all having this discussion. I think something that I have learned from every patient is my right is not everyone's right. And that the world is filled with perspectives that are not my own. And I will never know every reason for a person making a decision that they make, and that's okay.
Hmm.
And to allow people, provide the information, give the under, give the context, but allow people to make their own decisions. And that is how they will get to be where they need to be.
Hmm. Yep. I don't know if anybody else wants to share.
I'll go. I'll keep it short. I took a lot of time, so thank you for listening. For me, out of everything, I didn't really, I did some formal education. Most of it is like alternative. And what I've learned whenever I come across a client that's in pain, having some challenges that I don't have, I think I don't have the tools to help. I ask my heart. I ask my heart, what would my heart do? What would my heart say? What does my heart hear? And what I realized that my heart always seemed to have the answer. And it always typically comes back into just listening and being present with my client and also with myself. And then things kind of just fall into place from that. So out of all the information I know is really me being who I am and really also practicing what I share because I practice my breathing every single day. And I think that's why it's for me, I know it's easier for me to share and kind of maybe convince people to try it out.
I'll just close off, but obviously agree with everything that everybody said. But I think the most important thing that I've learned is that everything really starts with listening, not lecturing. We all have all of this knowledge, but it's our job to listen and to understand and to hear and then open our ears to that. I obviously want everybody to be eating a well-balanced diet, but it's my job to listen to understand that and to hear what the challenges are. And so listening is much more important than lecturing at the patient, and that can go a long way as well.
Thank you so much, everyone. This was just fantastic. Honestly, as we, something that I want to for people to take away is that this is like an ongoing conversation, right? This is something that you could continue within your own medical spaces, in your homes, and just kind of like really reflecting back in your wellness studios, find your wellness studios around. Definitely being able to like bring that back in because it's something that's super important. And I feel like we're ongoing. It's always ongoing education and learning, right? Learning about things that come up as we age and everything else. And as a social worker for over 10 years myself, coming early on, I just wanted to like fix, 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 help, 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 and do. And it's really checking in with the person and seeing like where is it that they're at, because they might not want that. They just might want like, someone to listen, for you to hold space, for validation. There's so many things. And I absolutely agree. And that empathy cannot, where some people be taught. And so it's like encouraging those empathetic conversations to happen in spaces, and creating those brave and safe spaces. And as an advocate for all of the people that I meet, I really want people to continue to bring that forward. So as we conclude, a friendly reminder to please spend a few minutes completing our program evaluation. I did pop it into the chat. And we'll also send it out after this program as well. But if you can take a few minutes to complete that, that would be fantastic. This is shared with our presenters, our panelists here. So they do get back the feedback and how everything landed. So that's really, really helpful for everyone and moving forward. So thank you so much, everyone, for this amazing talk. And thank you all. And, happy Lupus Awareness Month as we come to a close. Thank you, everyone.
Thank you, everyone.
Thank you, everybody.
Thank you. Okay.